Today, we're going to be talking about a topic that's going on, allergies. You know, and there's three main seasons. Tree season, which is still on us. All you got to do is look at the hood of your car if you just leave it out at night. Grass season, which will start, maybe already started, I'm sure it did. So now we're getting double pollen. You'll get like 2 weeks of reprieve, July maybe, and beginning of August, and then before you know it, it'll be hay fever season again. And then maybe a couple weeks of Christmas. So if you have all three of these allergies like I do, you just keep suffering and suffering and suffering. So I'm always looking for what's the right thing. And there's different things because people respond differently. So we're going to talk about all those things. So you see the title there, allergy and immune health. So what's so important about the immune system with the allergies? Well, it's extremely important because that immune system has a little weakness. That's how the allergy gets in. So why does this person sneeze when they're cutting the grass and the other person doesn't seem to bother them? We're going to kind of see what that's about. So I've used this for other talks when it comes to the immune system. This is a block of cheddar cheese. I think it's cheddar. And it's solid. And I have that as a representation of a perfect immune system. Now you have to understand there is no such thing as a perfect immune system. Even though you may be healthy till you're 80, there's some little opening there and something could get in. It just, you know, wrong place at the wrong time kind of thing. Some people have stronger immune systems than others. So how efficient is the individual immune system? It's actually very efficient. If you're exposed to something, your body immediately starts doing things to protect you. And I'm talking about 95% of the people have an immune system like this. People who don't are compromised somehow. They're either being treated for cancer with chemotherapeutic agents, maybe they've had radiation therapy, maybe they've had some massive exposure that's damaged them somehow. There's a lot of ways to hurt your immune system. Now this, I do this one, Swiss cheese, because this is what an immune system can look like. This may have a few more holes in it than I like. Some people will have more, and some people will have less. But it's those holes in your immune system that the trouble starts. And we all have some. I say here, even a healthy, well-functioning immune system has holes in it. I would say, it won't matter until you are faced with inflammation of some sort or some horrible overload. And even if there are days where allergy people will cut the grass and nothing happens. It's not enough inflammation to set them off. So inflammation is the key, and you'll see that as we go on. So these are I don't know, I think most people know most of the symptoms. But if you read this, oh, by the way, I forgot one thing important. At the table out front, since we're on this, you can actually get a copy of my presentation by email. We won't print them out. It's just too much money, too much work. But if you want a copy of this PowerPoint, we'll send it to you by email. And we do that, I think all of my lectures do that. There's nothing, I think some of our other lectures, you don't get that option because some of the material is trademarked or something and they don't give that out. Okay, so itchy eyes, itchy nose, we all know that stuff. But what about diarrhea, vomiting, bloating, swelling, pain, sinus pain? That's a big deal. Chest pain, there's all kinds of things. Swollen tongue, that's kind of scary because you're already halfway on the road to anaphylaxis. Throat closing, now you're really in trouble. You got to get to the emergency room. Wheezing, those with the breathing allergies, if they already have asthma and then they get an additional allergy, they can really be in bad shape. And as a matter of fact, I remember I was working at Bucks County Community College. I was on the administration. I wasn't teaching at the time. And I wasn't even 20, maybe I was 20 years old. So, we had a professor, I knew everybody. It was a small college back in the 60s. I think at that point maybe we were definitely less than 1,000 students. And at one point we were as low as 300 when I started. And it was a building process through 2 years there. There was a professor who never came out of the house and never came out of the office or the classroom because he had such bad allergies. So the whole house was air conditioned. He never cut the grass. He never stepped out the door. That's how he did it. And he survived through the allergy season that way. And that's kind of sad, I think, you know. Back then, there was not much you could do about it. You go to an allergist, they said, you know, well, I won't reveal this, but at the end of this, I'm going to tell you something about what my allergist told me. But we'll get to that. And I was going to my allergist even before when I worked for the college, so I understood allergies. Chest tightness, that's a horrible feeling. I have a good friend who gets it constantly. Dust, pet dander, you name it. Suddenly he's reaching for his inhaler and ends up in the hospital. Probably spends 20 to 25 days a year in the hospital where they have to nebulize him, maybe give him IVs, and it really gets bad for him. And he's had these allergies, I guess it started maybe when he was 10 years old. And those are right close to here actually right now. Feeling of being faint or lightheaded and a sense of impending doom. That almost sounds kind of strange, but when you're having trouble breathing and everything is annoying you and maybe you're sneezing, you get to the point where, oh gosh, what's going to go wrong next? So these people really do suffer. I take it most people that are here today have allergies. It's becoming more and more common, and it's becoming worse. I always thought that I was getting worse as I got older. And then I heard, I was listening to NPR on the way in the other morning, I think it was Monday, and they were discussing how the amount of pollen in the atmosphere and the time periods have changed. Tree season comes 3 weeks earlier than it did 10 years ago. And it's longer. And it's worse because there's so much more pollen. And the atmosphere, which is heating up, when you heat up the atmosphere, allergies will get worse. If it had been cooling down for the last 20 years, it actually would have improved and you would have thought, oh, I'm getting better as I'm getting older. But no, it's not me or you, it's actually what's around us. So now it could be a little me and you, but mostly it's just what's hitting us in the environment. So rashes. A lot of people come in here and they go, I got rashes. Well, that could very well be part of tree allergy. Let me throw this one out at you while it's still in my head. Let's say you have grass allergies. So grass is green, all right, unless it's a drought, but it's grass allergies. Greens that you eat, for instance, celery, is cross-allergenistic with your spring allergy, your grass season. So you could be making it worse thinking you're eating well by eating a lot of greens. This might actually be a negative thing for you. So this is very complicated and I can't answer quite too many questions here. By the way, I'll answer all your questions after I'm done. And we'll really let you do those questions. So there's a lot of things you could do wrong and not realize it. I've done a lot of wrong things. So I know you make a lot of mistakes until you can figure it out. And you need someone to guide you. So I find that a lot of people, their allergists, just kind of do the testing and then get out. Instead of holding your hand and saying, you got to try this, you got to try that. Here's a special list of foods to avoid. Do something. Not all allergists do that, unfortunately. And It bothers me. I think, come on, you're in this business, we're paying you, get into this and do us a little more work for us. All right. So here's what happens and why antigens and antibodies are so connected or get connected. Antigens, that's a substance that induces formation of antibodies. So the antigen is the thing that comes in, causes the problem, and your wonderful immune system, thank God, creates antibodies, and it goes to it and locks it up to prevent more damage, more inflammation. So this is if you get anything today, this is an important concept. This is how you survive. Now, some people do it better than others. Just the way it is. Why do we have allergies? Well, that's a great question, but I think it's really born in how much inflammation you can tolerate, how efficient your immune system is, and your recovery. So I might sneeze 5 times in a row on Saturday, and I'm still having a runny nose Wednesday, Thursday, Friday. My wife will sneeze 10 times, and the next day there's no problem. That's just the way it is. That's who you are, at least at the moment. When you get an overload, and too much of this is going on, your body's kind of compromised at that point. So other bad things can happen, stressing out your body. So the fewer of these that happen, the better it is for you. So, breathing. It doesn't matter if you have sneezing type allergies or lung type allergies, bronchial type allergies. You breathe in 2,000 gallons of air. In that air could be 2.5 million contaminants, particles. You can't see them, usually, unless it's pollen on the hood of my car in the morning. And when I walked out this morning, I live in a really green area, woods, brush, it's bad. My car is silver, and I couldn't see silver on the hood. It was that bad. But I know when I park here in the parking lot, I got, washed the car on the way over. When I go out tonight, that car is almost going to be perfect. But that couldn't be possible when you're in that much green. Well, I live in Buckingham, and it's pretty rural still, in spite of the housing developments. And worse yet, I back up to the Neshaminy, and that pollen just comes up the hill in clouds sometimes. You can see it. So it's a tough spot to live if you've got an allergy. And there'll be something at the end about that. The average person breathes in 250 million particles per day. These particles could be pet dander, dust mites, all types of bacteria, drywall. When I do drywall in my house, because for some reason there's holes in my wall occasionally, my wife thinks decorating is a demolition event, I think. So I'm fixing it. I never sand it. I always wet sponge it, and it just solves the whole problem for myself and maybe my kids. So you're exposed to all these things. Any one of them or all of them could be giving you trouble. Oh, well, how did we get there? Come on. So, generally speaking, your reaction's harmless. But if you have a reaction every other day to dust, grass season comes along, before you know it, you're starting to really labor the whole system, the whole immune system, and your antibodies and antigens are going crazy. You start wheezing, you start itching, you could end up in the emergency room, and there's a lot of things that can start going wrong if your allergy really gets out of control. And of course, let's see, oh, here you go, this is what I was looking for. IgE, if you look at your blood work, just any blood work that your doctor does, you're going to see IgE. You may not have even known what it was, but they run it to make sure you're not being overexposed to something. It's just a simple thing to put into the blood work, and the doctor looks, and he sees an elevated IgE, and he starts thinking, what's going on here? You know, and then he might ask a couple questions. And he might refer you to an allergist, because that's probably what it is. So that's an important marker on your blood work. So next time you do blood work, or if you have your blood work on your phone or at home, check out your IgE, see what it says. So how do we treat allergies? Pharmaceutical products, there's a lot of, and some will work, and some won't for some people and not others. So in my day, I did almost 20 years of pharmacology, or at least working for pharmaceutical companies. Wasn't all pharmacology. In the beginning, I was just some ordinary person. And they would give me jobs I think that nobody else wanted, because you're the new guy for the first 3 or 6 months. But eventually I ended up doing things, particularly in allergies. I have a background in antihistamines and decongestants, nasal type topical allergy products. In my mind, I think the topicals, things you spray, are more effective than the things you take internally. But it can't be for everybody. Some people are going to do better with some of the new antihistamines in particular. And antihistamines do have their issues. And in my mind, there's a lot of cognitive things about antihistamines that I don't like. And they're being pointed out. Benadryl, we're talking about Benadryl actually causing an increase in dementia symptoms at nursing homes where they can keep track of this stuff. Nursing homes used to give, at bedtime, everybody got a Benadryl so that the nighttime nurses could have an easy shift. That's the way I saw it, but sure they wouldn't say that. But everybody slept. Well, guess what? It causes more cognitive damage. You know, they become more and more, I tried a brand new antihistamine about 3 weeks ago. I was having some really big problems. And it worked, but I couldn't hold my head up. And he said, oh, it's non-sedating. Well, thanks, doc, I can't get out of bed. So I dropped that. And then he suggested a nasal one. I'm going to try to think of the name, Astapro, which is real expensive. And he says, it's topical. It's not going to be the same effect. It's special. Knocked me cold. It worked, but I wasn't up long enough to appreciate it, frankly. So antihistamines have that built-in problem, and some people are going to have it worse than others. And the older you get, they say, the more effect that effect is. So maybe a younger person can handle it, but I even remember actually working at the college, when I was talking about that earlier, taking antihistamines, because the college is like being in the woods, if you've ever seen Bucks County Community College. And then the Chamonix is right behind it, if you've ever seen where the bus is there. So I remember taking antihistamines and falling asleep in my office. And somebody wakes me up, and I'm thinking, oh, I must have dozed off. And they, yes, you did, 4 hours ago, because it's a deep sleep that you can get out of it. So yeah, it's an issue. So there's no cure for allergies. We're going to show you some supplements that might be helpful, in fact usually are. Avoiding allergy triggers and reducing contact with that can be helpful. Some people got to hide from pollen for a couple of weeks until that passes. Avoidance, I mean, that's part of not making contact with those things that are going to stimulate your immune system and change what's going on, all those antigens running through your body, and IgEs and all that stuff. You don't want that if you can help it. If you work for Asplin and you cut trees, good luck, because they're making that stuff all day long. I can tell you that as a high schooler, I used to work with walnut, maple, and oak in wood shop. I used to love that, and I work on a lathe, so it makes tons of dust. Within 10 years, I was allergic to walnut, maple, and oak, and never got better. I mean, I can't go near oak dust or maple dust. So if I do something, I got to wear a mask. It's just too much. And of course, in high school in the 60s, nobody gave you a mask. It's a miracle they gave you goggles, right? Some kind of protection. Supervision, yeah. All right. So, what's the chemistry behind allergies? Well, we kind of already said that. We want to avoid that inflammation. And that's all that's about. This is a little too complicated, better to read it at home. All right, what are the main foods that cause allergies? Well, I already mentioned the celery, greens in particular, and the grass season. I don't know how much that would affect the tree season, but then tree season's a problem because peaches, cherries, all those things could be a problem if you're not careful. Fruit trees, that type of thing. So peanut allergy, it's one of the most common allergies. You could speculate why it wasn't a problem when I was 20 or in my teens. I never heard of a peanut allergy. And I was an allergic kid. Who would have thought of a peanut allergy? So in school, nobody said, oh, we can't have peanuts in the lunchroom because kids will be keeling over. Nobody keeled over. So what's happened? Well, there's speculation that today's peanut isn't what it used to be. And there might be something to that because is everybody familiar with A2 milk? No? I find most people aren't. So over here we got a field of today's cows. And people are allergic to cow's milk. A2 cows are domesticated or bred with 1890 animals, the genetics of an 1890 animal. All right, am I saying that clear? Guess what? A lot of people can take A2 milk and not have the symptoms they get from regular milk, or the milk we drink today. So there are farmers who are breeding these A2 type cows. I don't know why it's called A2 actually, but that's, when you go to the market, you'll see A2 on the package. It's usually red and white for some reason everywhere I go. Oh, Costco even has it. They have, their package is a white package, and they sell it by threes. Wegmans uses the typical A2, which is red and white. Oh, and that's a coating. So that's full fat. 2% is blue and white, and some other color for 1%. So that's how they do it. But the animals are not domesticated the way today's animals are domesticated. And it took a little doing to do that. And when it first came out, everywhere you went, you couldn't get it because it would sell so fast. But now it's starting to sell. Not every store carries it. I was in McCaffrey's and asked for it. It wasn't there. Giant doesn't have it. So you have to look around for it. But I know Wegmans does and Costco, and that's where I get mine. And it works. My wife couldn't drink milk for a long time. I get her A2 milk and she drinks it fine. If you just hold your questions to the end. Which foods bother me? So you got to figure that out. This is a good slide. So the food you should be suspicious of is the food you eat every day. If you drink milk every day, it might be it. If you eat eggs every day, it could be eggs. So how do you know? Well, the only way to really know that is to remove it from your diet for 2 weeks. You may get better, and it could be coincidental. So you start eating it again. You reintroduce it at 2 weeks. And if you really get a lot of symptoms back, you've kind of identified one. That's not 100% perfect, but it's pretty good. And most people can identify if they do it properly that way. I have another one that I'm not sure I hear much talk about, but I know it exists. And that is to take the food, let's say it's a potato. You boil that potato, just take a piece, potato, boil it. Maybe you could, you don't even have to mash it up. You could just eat the potato. You can eat the potato, but we don't want you to eat the potato. We want you to put it under your tongue. So you can mash up a little bit of it, put it under your tongue. Before you do that, give yourself a 5-minute rest, take the pulse reading. All right, let's say it's 60, let's just say 60. Then you give yourself the potato under your tongue, or whatever the food is. I would like shrimp, lobster, make it something nice. Put it under your tongue for 2 minutes. You can swallow it after that if you'd like. Take the pulse. If that's an allergen to you, you now start giving off histamine. We'll be talking about histamine in a moment. Histamine raises the heart rate. So you can be kind of suspicious about that food if that happens. You probably want to redo it another day and see if you get the same result. And if it is, now you're not going to be eating potatoes. And I think a lot of people eat potatoes every day. That's probably not that uncommon. People call rice the non-allergic food. And that may be true for the Western Hemisphere. But it turns out in the Eastern Hemisphere, where they eat a lot of rice, it's the opposite kind of thing. Potatoes don't bother them. But rice, they have a lot of rice allergies. Who ever heard of rice allergy, right? But that is the case. So it's how much you eat every day. That's the suspicious food. And that's why allergists will tell you to use a rotation diet. And that means, don't eat the same food every day. You may have to only eat a food once a week. Now, I love corn. I've lived in the cornfield. I mean, all that area up in Bucks County is a lot of corn. And I used to eat corn a lot. Maybe not every day, but a lot. And somewhere around 30, 35, somewhere around there, I couldn't eat corn anymore. It was deadly. Now, I could eat corn on the cob, 1 or 2 ears, once a week. That's my rotation, once a week on corn. Spinach, which I'm allergic to, gives me hives. It's pretty dangerous. If I don't eat it for 10 years and I accidentally have some spinach, boom, break out in hives. So I know I can't even rotate that one. That one's kind of deadly for me. Hopefully you don't have anything quite that bad. But I think I was about 42 years old, and be eating spinach for 42 years, roughly. I sit down to dinner one night. I eat we had spinach, and we only had spinach once a week or so, and break out in this massive hives. So I didn't even get it. I couldn't put 2 and 2 together. It happened 2 nights later at a restaurant. Boom, spinach. I knew immediately what was going on. So that's how these things can be figured out, or not figured out. You got to be thinking all the time on this. So it's an important concept. You're looking for what it is that caused it, and backing up sometimes is not that easy. Oh, I had for breakfast this, I had this for lunch. So which one is it? Very hard to tell. That's why why allergy tests, food allergy tests, can be helpful. And what I'm telling you about actually testing yourself might be helpful. So to me, this is probably one of the best slides here if you're still trying to figure out what's going on. So what is histamine? Histamine is the chemical that's released by your immune system when you encounter an allergen. And it can be it could be havoc, or it just could be a little itchy. All right, you just don't know. And if it constantly giving off histamine, histamine does cause problems because it increases your heart rate, and it does some other chemical things that aren't so happy. So hopefully you're not histamine driven all the time, but there are people who are, and we're going to see that in a moment. So histamine has an effect on our behavior and in our cardiovascular system, maybe even in our joints, just all over the body. So there are foods that are going to be higher in histamine than others. Eating, if you're really an allergic person, eating high histamine foods is not in your best interest. Doesn't mean you're going to have an allergy reaction to them. Just means it's piling on a little more histamine than we would like. And you know, the symptoms are pretty clear: diarrhea, shortness of breath, hives, headaches, skin irritation. I would include mood changes, behavior changes, headaches. Did I say headaches? Probably had that there, yeah. So vitamin D. We have mast cells. Mast cells are just, well, they're in very specific places, but that's what the allergen attaches to, and that's how it ends up getting the antigen and the antibody. It's in that mast cell, what that mast cell does. When you're inundated with allergens, that mast cell is being ripped apart, and fluids start going through the system where they shouldn't be. It really gets ugly. So if we can bind those sites to something else, that's a good thing. That may help your allergies a lot. Turns out, and honestly, I didn't know this myself till I was down the road a long distance, vitamin D binds to those receptor sites. So that's one thing that should be, if you're an allergic person, should be taking vitamin D. How much? Depends on your blood work, how high your D or how low your D is. Some people it's going to be 1,000 or 2,000. Some people need 5,000. I can tell you that I just had a conversation a month or so ago with a physician, Michael Murray, is an ND, and he's in Vancouver. He's written 23 books. He used to do the formulas for natural factors, so he's pretty well known in the industry. And he has a little private practice that he keeps up. I think he's kind of semi-retired at this point. And I said to him, what is the right dose of vitamin D? I think this is important. And he says, just, he didn't even think, 5,000. Now, you know, if you're here a few hours every day, you hear people say, no, 1,000, I don't want to take more than 1,000, or I don't want to take, you know, or somebody comes in and says, my doctor says I need vitamin D. And I go, why? And they go, oh, my test is real low. Then why 1,000? If your test is real low, you probably need 5,000. Don't you want to raise it? You know, 1,000 is not going to be enough. So what's on that blood test, your D level is important. That's how you figure out how much you need. But most people need 5,000. And it will not jack your level up usually. So I think most of my testing in my earlier life, I was in the 30s, which isn't bad. It's healthy enough. But I was, you know, having some issues and the allergens and all that type of thing. So I took 5,000 for 6 months, and suddenly I'm 70 or 73, which is where, when you're having immune problems, you want, and the literature says you should be between 70 and 90. Suddenly I'm in the right place. Did it help me? Not sure. It may have. So binding up these sites is important, and vitamin D is where you want to start. Oh, there's a vitamin D and K. So never take D by itself. It should always have K, because it, first of all, works better, and it takes your the calcium floating in your blood and it puts it into your bones where it belongs, not in your blood. So these are important products. Doesn't have to be this brand, but that's a 5000D, and it's, I think, 100 and, oh, I have one here. Do I? Yes. So if you're on a blood thinner, you don't want to take more than like 45 micrograms of K, and that should be perfectly safe. This one has 2100 micrograms of K. And if you're not on a blood thinner, that isn't going to matter. So it's perfectly safe. And it's doing a lot of good for your cardiovascular system. The more K you have, the more calcium's being washed out of your arteries, and your circulation is getting better. It's minuscule every day, but it adds up. So suddenly you're doing better in a cardiovascular way. Your bones are getting stronger. All the right things. You're heading in the right direction. But just keep in mind, blood thinners, you don't want to take a maximum dose of K. But 45 hopefully is enough. That's the way the companies are making them. And we have quite a few that are 45 because we have a lot of people on blood thinners. So important product, vitamin C. That's antihistaminic. You know, boy, that's pretty simple. It's inexpensive. It's an antihistamine. And this has been known, for 30 years. Take vitamin C, it should help a little bit. And when you take vitamin C, you want to make sure you're getting it with the bioflavonoids. So I picked this one because it even says it on the front. That's probably our biggest selling C. So the bioflavonoids are part of vitamin C. When you take them out, you're taking away one of the most important parts of vitamin C. So when people say, no, I just want ascorbic acid, well, if you read the label on ascorbic acid, there's no bioflavonoids. So is that better? I don't think so. You want the whole product. You want the bioflavonoids. And they do. Maybe the bioflavonoids are more important than the vitamin C. I mean, they're good things. Asparagine. By the way, we're going to talk about quercetin in a minute. I don't know if quercetin is in that, but that's another bioflavonoid. I don't think it is in there. Quercetin. So quercetin and turmeric is a very logical combination. And we have that. Well, I didn't get a combination, but there's your quercetin complex, has a C in it. That's kind of logical. And then I added turmeric, second product. You might be able to find quercetin and turmeric. I think we have one, right? From, who is that? The herb company, right? Now it's nettle. We have one. But not everybody wants to do that, so they'll separate it. And I just gave you an example of 2 products that would do the job. So quercetin, bioflavonoids, antihistaminic, very logical for someone with allergies, and has a whole lot of other things that are good for you. There are people out there telling you it actually fixes your telomeres. So I guess we can call it anti-aging. All right, maybe it is, maybe it isn't. Turmeric is just a wonderful anti-inflammatory. People here taking turmeric? Probably, right? This is one of those products that a little more might be better than a little less. And quercetin, probably the same way. Okay, yeah, that's all right. It may not be a great idea to have a product with turmeric and quercetin, just because if you're on a blood thinner, then the turmeric becomes a problem, because turmeric does thin blood a little bit. So to put them in the same product creates a problem for the supplement manufacturer, the whole thing. It just becomes problematic. Keep them separate. Now, quercetin and bromelain. I'm a big fan of bromelain for allergies. It really does a good job. And when you hook it up with quercetin, it's a very logical combination. That is an allergy product. That's how that was made. In fact, I don't know what they say on their marketing. Yeah, they actually say it supports healthy seasonal immune function. They're just saying that's for allergies. So that's a logical combination. You could put it in the same pill. and that to me makes sense. There's a similar product by Source Naturals, activated, they call it activated quercetin. They were one of the first to have it. All quercetin is activated. It's going into special delivery systems. There's a liposomal out there. Price runs from standard $10 a bottle to $30 a bottle, depending on the delivery system. Do you need a super delivery system? Maybe not, but the super delivery systems usually end up being a one-a-day product, as opposed to maybe 2 or 3 times a day for regular quercetin. I'm just going to take a water break because my allergies are killing my throat. N-acetylcysteine. This is a real powerhouse. N-acetylcysteine causes you to make glutathione. And glutathione is the master cleanser of the body, of the cell system of the body. So you can get glutathione, but it's poorly absorbed. And NAC is very inexpensive and does the job. But NAC has another thing going for it, in that it's a mucolytic. So mucolytics thin mucus. So you move things out of your body a little faster, as well as being an antioxidant and cleaning up cellular debris and all that. It's very important for an allergy person to take NAC. I mean, it's really a core product. The other things you can pick and choose, but NAC is a basic. Very important. And by the way, you go into a hospital and you know, not that you can go there, but if you go to the pharmacy or, you know, anywhere in the ICU, NAC might be in the IV drip for patients for a number of reasons. So it's an important product. Oh, by the way, isn't that the treatment for lead poisoning too, I believe? So it cleans the liver and it binds to certain things. So it is, I believe, the lead poisoning treatment. Lead or one of the heavy metals. NAC, inexpensive, easy to take, usually 1 a day. I've taken 2 a day if I get really sick with a cold or something. Because it's such a great mucolytic, it really helps you out when you have a cough. So how does histamine affect the immune system specifically? Well, all that inflammation makes you even more sensitive. It just destroys everything you're trying to do to make yourself feel better. It's also been demonstrated to affect chronic inflammation and regulate several essential events in your immune response. Now, was that an allergy sneeze? I heard a sneeze. All right. So that might be an allergy sneeze. I don't think there's a lot of wind today, right? So windy days are obviously going to be a problem. Fans whip up, you know, if you have bare floor can be cleaned. Carpeting, on the other hand, can be a problem. So I remember my allergist saying to me, "Oh, we got to rip up all your carpeting. You have really bad allergies." And I went home and told my wife that the carpeting's still there, probably. Okay. Now, for those of you who believe in homeopathic medicine over some of the other things, and there's nothing wrong with that, 3 homeopathic products that I use quite a lot. Histaminium reduces histamine. If you use it properly, it will do it, and they have directions on the box. You've probably got to overuse it if you're going through a bad period. So that would be something you can do. You can be very flexible with the dose. Allergy calm, well, it's the kids, doesn't matter. The adult one, they have a treatment, a 1-hour treatment where you put 2 under your tongue every 15 minutes. And believe it or not, that will slow down sneezing and coughing and the whole thing, and the event itself. But I always use it with histaminium. Excuse me. Bee sting, histamine. You've been exposed to something. Somebody's doing work in the house, a lot of dust, histamine. Ivy poison. Is it poison ivy or ivy poison? I never forget that out. But either way, that histaminium would be appropriate as a treatment, along with other things, because you don't want to itch. It's histamine, and it's diluted. That's how homeopathics work. So you're actually getting a little bit of histamine. Your body's making antibodies, remember the little chart, and you're alerting your body to something's gone wrong. And it can save you from going through a lot of trouble. So, to me, the word histaminium always gives it away. But how does it work? That's the big problem. Histamine's your enemy. It's not your friend. So how does histamine hurt the gut? Well, it does. It causes dysbiosis. And dysbiosis can lead to other conditions, Crohn's, IBD, intestinal bowel diseases of all types. If you take some probiotics and enzymes, it might help correct that. But this is where allergies to food could be starting. This may be where you suddenly become allergic to milk or something like that. So a lot of these things may have happened when you were a child and you don't remember. So, could be that. So histamine can hurt you through the gut in particular. It can hurt you through your cardiovascular system also. Now this gets a little more out there. Histamine and brain damage. That's been demonstrated. So this is something to worry about. If you've got a child with a lot of allergies, you want to look at their emotional state also. This could be a problem with the elderly or anybody at any age, but in particular, I'm thinking children. If they're going through allergies, keep a good eye on their behavior, that type of thing, and we're going to see a little more about that. Symptoms of histidilia. Well, histidilia is over too much histamine, over the top histamine. You might get insomnia, belly aches. Kids get belly aches, don't they? Sometimes you got to wonder, I wonder what's causing that belly ache, or is this just a child trying to get attention? Nausea, persistent headaches. I suspect, I worked in migraine treatment and products for quite a few years. I suspect that 25% of migraines are histamine related in some way. Maybe it's worse than that, I'm not sure. I mean, I never figured it out. And nobody ever talked about it. You go to a meeting with a bunch of pharmacies and chemists, and you sit down at a table, well, what do you think? And they kick it around, and you walk out and you go, whoa, what did we just talk about? They're trying to get a product to market. They're not too worried about how, why, but we have an audience of migraineurs. Let's give them something to make them feel better. It didn't go into depth. Nobody cares what caused it. We're just caring about the treatment of. So you got to think that, some school somewhere, Mayo Clinic, Cleveland Clinic, they may be looking at this and doing studies, but it would be odd to see a pharmaceutical company supporting that research. They're probably getting government money to do, not getting a lot of it. So there's reasons we don't know everything about this. However, sleep disturbance, by the way, big problem. This man, if you're an allergy patient, you should own this book. I think I'm sure it's available on Amazon. I don't know if there's still a Pfeiffer Allergy and Brain Center in Princeton. There used to be. That's where his treatment center was. And it was an allergy clinic, basically. Now, he may be treating schizophrenia, psychosis, histophilia, all kinds of conditions that a lot of doctors may not even know exist. You say histophilia to a doctor, yes. Yeah, Pfeiffer's gone, but the book's still here, and it's just as good as it ever was. In Pfeiffer's book, he actually shows you histophilia, schizophrenia, and then he shows you the vitamins that offset that condition. Now, in schizophrenia, right away, he tells you in the beginning paragraph, he can only fix half, 50%, doing this. The other 50%, he doesn't know. So he says that up front. But it's worth a try, isn't it? And for a few simple B vitamins, and he doesn't get into really complicated vitamin schedule. It's easy to follow, niacin, things like that. B vitamins in particular. He may have a few unusual things in there, but he talks a lot about methyl donors. And methionine, betaine, choline, folate, and B vitamins in general are how he does his treatments. So this book is amazing. It's worth reading. But it's a little skinny book. Gets right to the point. Doesn't fool around talking theory and all that. Pfeiffer was just not that kind of guy. He was a doctor who wanted to treat things. So, methionine. Well, SAMe is a powerful methionine product. Now, we think of it for depression and other mental conditions. But if you think of Pfeiffer saying, well, if you're not a good methylator, maybe you need methionine and methylfolate instead of folate, that type of thing. So he's bypassing your methyl genetic problem and actually fixing it, and maybe your allergies will get better also. So don't underestimate SAMe. It is a methionine. And yes, we use it for joint pain, we use it for depressions and anxieties and for a lot of conditions, but it could be an allergy product. And you could use it maybe with quercetin. Might be a logical combination. Or nettles. The herb nettle is a drying agent. And in fact, there's a, excuse me, some companies have come up with nettle quercetin combinations, which are very logical. And I don't see a reason why you can't take this with pretty much any pharmaceutical product. Whereas some of the SAMe you can't take with a lot of the serotonin reuptake inhibitors and other psychiatric drugs. So there's a problem there. Nettles and quercetin, I don't think that's a problem. This is more of a combination product. I'm just going to tell you what's in it so you get how logical it is. They use a little vitamin C. They use quercetin. They use N-acetylcysteine. They use nettles. I mean, that's a pretty logical, straight for the nose, kind of a allergy product. Nettles dries up secretions, so it's pretty effective. I remember playing with it at one time where I took a lot, and it over-dried. So I had to back down once I got to being over-dried, and it was pretty good. It was working well. I could keep, working the dose down until you see that it's not working anymore, and you got to go back and maybe a step. So we got some really good products that you can use that generally have no side effects. I've had somebody tell me that quercetin gave him a bellyache. That's 1 in 25 years. So it could have been anything that gave him the bellyache. I don't know. Things to do for allergies. Cool your home using an air conditioner, but don't use humidifiers or swamp coolers. You know what a swamp cooler is? I think I'd be from Louisiana or something. You know what that is. These are those things you fill up with water as a fan. It blows over the water and cool air comes out. It's not really an air conditioner. But the problem with that is it's pushing pollens around. It's making too much humidity for a lot of allergy sufferers. It's not a great thing. Air conditioning does all the right things. Reduces the humidity, takes pollen out of the air, prevents pollen from coming in the window because you're keeping your house closed, and that's better for you. With that in mind, I had this old-time allergist back when I was 18, and he says, "Is your car air conditioned?" And there's 1963. Who has air conditioning? A few people did. The rich. And he says, get an air conditioner for your car. He says, never drive a car with the windows open. Well, think about it. This car I had these vents underneath, and just straight air would just blow in and up your nose. So what's it doing? It's forcing pollen up your nose. The worst thing you can do. So since then, I've had my windows pretty much closed. I rarely ever open them. So take that for what it's worth, but I got to tell you, it's one of the biggest offenders. Needless to say, I never had a convertible. I've ridden in them, but I don't like them. You got to clean all the time. I'm always cleaning at home, and it's that dust you got to get, and you got to do it really clean. And if you think, I walk into a room and I go, oh my God, there's blinds, there's curtains, the carpet, all the furniture. There's a lot of cleaning. So to do a room, you got to be pretty good at it. And I've gotten good over the years, so I clean pretty well. I come from a restaurant background, so we know how to clean. There's one thing we do right, it's clean. We're going to get to that. Let's see. You want to stay away, keep those outdoor pollens outdoors. That's an important trick. After being outside on hot pollen, get a shower, change your clothes, get that pollen off of you. And be careful when you bring your clothes in. Now, fortunately, I don't have neighbors close, so when I come in from working outside, I basically am almost totally naked in the laundry room because I put all the stuff in the washer. Then I run upstairs and take a shower. It works fine. So, that's how I do it. And it solves a big problem. You don't want all that pollen all over the place. Oh, I still want to give you one more. Topical products, the nasal products, are usually great. Saline is a great place to start. You can't beat this. Just wash the nose out 3 times a day, and it really helps. Now this one is an olive leaf product, which I believe has saline in it anyway. It has some fluid in it. It looks saline to me. This is a big seller. The olive leaf in itself seems to be an allergy product that you can work with. This is an oregano product. Great for cleaning out the sinuses, great for killing bacteria. I don't think it's quite as good for allergy, but who knows? I just want to make sure I hit all these. The mushroom products per se are not going to fix your allergy, at least that I know of, but they're going to help your immune system. So mushroom products are really good for the immune system. And you got to pick and choose. There's a lot of mushroom products out there. Some are better for a cold or a virus. Some are better for cancer. Some are better for allergies. So I put turkey tail out here because I think it kind of does hit that, might hit that. And this has reishi in it, so it might be the right one. But keep your clothes, your house clean. Air conditioning is your friend. And these topical nose sprays are pretty good. On a note, if I can shift over to my pharmaceutical days, I worked on Flonase. So I'm very, very familiar with Flonase. and it's over the counter now. We never actually talked about that as a business thing, but when it went off patent, somehow it's mild enough that the FDA said, yes, you can use it. It does work, and it's relatively safe. So that's why I became very interested in the topical approach rather than the internal approach, because they have the antihistamines internally have a lot of side effects. Also, apparently, squirting antihistamine up your nose is not a good idea because it gives you some of the same side effects. Now, some people might get away with it, but I certainly didn't. In fact, I had a rough maybe 3 or 4 days. I found myself kind of, I think because I was tired, forgetting a lot of things. You know, worse than I just walked in the room, why am I here? It was even worse than that. Like I'd open a refrigerator door and I'm there, what am I opening the door for? What was I supposed to? And then you close it and you walk over to the counter and you realize, oh, back to the refrigerator. So that's the way I was behaving, and I knew I couldn't keep it up. It's too crazy. By the way, it worked great, but I couldn't stand it. So there it is. It's a saline nasal spray, clear, with xylitol in it. And people say, why xylitol? It's a sweetener. It's not actually an artificial sweetener. It's sugar minus one molecule. So it's a 5-molecule sugar, I think six sugar, yeah, sugar's a 6-molecule. Xylitol is a 1-molecule. We know it kills bacteria in the teeth, so that's why dentists love it. But in the nose, it's soothing, and it protects the mucosa. And oddly enough, when you put it in your nose, it also protects the mucosa. It protects from pollen sticking to the mucosa because it creates this sugar barrier. So it's actually a really logical product. Why the crazy name? X, yeah. How do you want to say that? It's actually, they just pronounce it clear. The X is from Greek for wood. Begins in Greek as an X, let's say. So it's a wood alcohol. And whoever came up with the name, that's what they were thinking. I don't know. Seems like a crazy name, but it sells quite well. So let's just review stinging nettles, vitamin C, quercetin, and bromelain, olive leaf, butterbur. Butterbur, you're not going to find it. It's hard to find. It's very good for headaches, which could be allergy related. I don't know. Most doctors never heard of it, and every once in a while you'll find an old-time neurologist that goes, yeah, butterbur.
See what you got, and we'll go from there.
Ginger, turmeric, NAC's there. Oh, licorice. Licorice is in a lot of products. This one might have licorice in it. This licorice seems to be something that goes with cold and cough. It seems to work antivirally a little bit, and it seems to be good for the mucosa. So licorice is included in a lot of these products. Eye Bright. You can't even find Eye Bright. I don't know why. But you find it, but it's hard to find. Is it really great? It is not usually very good by itself, but if you mix it in with other things, it can be. Plantain, there's a nasal spray. MSM can be good for allergies. And black seed oil, which is getting a lot of press, is good for a lot of things. So black seed oil is a pretty good product. Very good anti-inflammatory. So here's some products. There's the black seed in capsule and liquid. There's other brands. We have it here. It's a high strength and it's not terribly expensive, so it's like a nice product. And these are some of those herbs that I showed you. I might point out that Gaia's olive leaf, probably I don't know if they would be originators. It strikes me that this product's been out for a long time. It's really a great product. It's a little more money, but it works great. Wild Harvest, they just have been doing a great job. So we have a lot of Wild Harvest products. You'll see a rack of it in. Is that rack right there? So you can find them right there, and it's other places in the store.
powder out there. So, but a lot of the protein powder.
So for the immune system, vitamin A, B, E, C, omega-3s, fish oil or algae,
Now, I understand there's pure
mushrooms,
so this has
lactoferrin and colostrum. So lactoferrin is the
9 grams,
non-milk colostrum, I guess you could say,
9 grams of protein.
used with cancer.
You look at the ingredients. Beef joe. So a little bit of this, a little bit of select
Cordyceps, turkey tail, both of those could be used in allergies.
Steve Reeves, Arnold Schwarzenegger is another good. The big muscle
Colostrum,
they didn't have availability.
this particular one, the top right corner, comes with a little collagen in it. Collagen is actually good for protecting mucosa,
Eggs. You can
rebuilds
get a flat
tissue.
6x5, 30 eggs.
Gut health and inflammation,
Right across.
get a good probiotic.
$2.50.
Probiotics do seem to fix some of those gut-related problems.
This and some.
Excuse me.
Some that, no, I understand it's a lot of.
This is a probiotic that is pretty good for the respiratory
My
tract.
thing is it's all natural.
So some probiotics are very specific, and this one is very specific.
All natural.
And then there's this one that's not so
Well, I don't
specific,
know.
but I think it's a great probiotic. I only use one a day, but the other day I was feeling, I was having some stomach problems. I don't know if it was related to allergy. And I took 2 at the same time. It's actually a 2 a day. And maybe within 2 hours, I had no problem at all. I felt great. In fact, I'm still feeling great. When did I do that?
Using this so much as like a
Monday?
replacement.
So I have to say, it really did
In my car, I
made
grind
me
my
feel
own-
much
you know, I try
better.
to get decent beans. I grind my own beans.
6
you know, all
tips
these
to enhance
things that
immunity.
we do. I try to
Eat
cut,
well and
you
eat
know,
correctly
Stay away
for
from the
your
processed
allergy.
sugar.
Be physically active,
There's
really
something-
important,
There's something
because
there's
it
something to it.
promotes
It's like it feels
expectoration
like
and
this is
a lot
part
of
it,
other things.
right? Like
Maintain a healthy weight.
selective supplements.
If you're overweight, your
It's
allergies are going to
really
work
eggs.
against you more.
Yeah,
So it's
eggs.
important.
Eggs are,
Get enough sleep.
oh, I've cut
Gotta
out
sleep.
all
when
the
you're
processed stuff. It's
have
so-
terrible
it's
allergies,
gross.
a lot of times you wake up every couple hours, so it doesn't help. Sleep a little more maybe.
What did the cave-
Quit smoking.
Things, right? Yeah,
I'm not going to ask if we have any
how it
smoking.
smelled.
I hope you don't.
He rubbed beef tallow
Avoid
skin
too
for
much
someone
alcohol.
Or whatever, you know what I mean?
It's easy to do, just don't pick up the glass, or don't
Take them off.
don't drink alcohol. Avoid, sunlight and fresh air. Got to be careful with the fresh air one. But my allergist has some ideas for me when I first, he's my third allergist, I think. You'll see his idea in a minute.
Stuff in my feet in the synthetic
Now,
socks.
this is not his idea, by the way. This is my experience. So I grew up in Wobbly Crest,
Am I wrong?
and my
Like,
family had
the detox,
businesses,
people put those patches
hot
on
dog,
their
hamburger,
feet,
ice
and
cream,
they wake
all
up
that stuff.
and it's black. So I don't know
And
if it's a scam, but they
sick as I might have been at home in Bucks County,
Yeah.
one
Does
day
it-
down
you
there,
find-
and I was not sick at all for the rest of the
Do you?
summer.
So it's
So we were
detoxing
there for
through your
3 months or 2.5
through your
months,
pulse.
and we would come back, and I'd immediately start having allergies again. So when I'm there, or any
Yeah.
other beach, this happens, I don't know where this beach is actually,
Yeah, it's like
but
black.
when I'm at the beach, when I'm at a shore spot, I don't have a problem.
Yes, we just try to. We
I mean,
just try to
I've never
stay-
been so healthy
try
as
to
when I
stay
lived
simple,
there.
right? And you just-
Sorry, I don't live there anymore.
Yeah, I mean,
My
some- I mean, I
allergist,
think, you know,
however,
back in the day,
says
protein
to me,
powders, okay, you buy the biggest
you're
jug,
my,
and
I think
for
he
the
said I'm his
cheapest
worst
price, and everything
patient,
you
which
start
I'm very
looking at,
surprised because he had
raise
hundreds and hundreds of
all
patients.
crap, all that.
This was his recommendation.
It's no good. I do all
Move
these-
to
I have all these
Arizona.
little techniques. So, like,
I'm gonna
sugar,
pack up and move to Arizona. He says, well, that's, you're gonna live a healthy
and I cut
life.
it with,
So-
what's that, monk fruit?
It's a suggestion that's not very
Yeah, yeah,
realistic.
yeah.
Although some people, when they retire, they move out there. It would make you feel better. But the shore does too for most people. So everybody's got
Thank you
ideas.
so much.
This, to me, is avoidance. So is that one. You're avoiding a lot of allergens. So that might be the answer for a lot of people. But in the meantime, we've got a whole lot of product, and you can start working on some of these things. Now keep in mind, we have that 10% off coupon in your bundle, just for you. Anything you buy in the store today, it doesn't have to be allergy products, you're gonna get the extra 10% off. So it's a real deal. And we have to twist some arms to get that 10%. So it's not easy. Yeah, the problem is the margins are so slim that it's hard to do that. Sometimes we need the cooperation of the companies to pull that off. And sometimes they cooperate. They think, things like this they like, because we talk about their products. At any rate, that's it for today. So let's do the questions. And I'm going to give you a microphone.
Dr. Phil, is there anything topical for itchy ears?
Okay, that can be very tricky. We have out there tea tree oil in an ointment. That works for a lot of people. It'll cure your toenail fungus, but it'll also make your ears feel better. Yeah, so that's something to think about. We have zinc ointment, which some people seem to like. Am I missing?
Well, in our ear section, we have some ear drops.
Eardrops, but actually I'm thinking calendula cream.
Yeah.
Yeah. The cream might be better. It won't, you can kind of clean it up. The ointment might be runny and it might be visible. I don't know if that bothers you or not, but a bunch of cream coming out of your ear is not a good idea. So you put a little in, work it in, and you might get a pretty good result. Yeah. Calendula is an easy one. Okay. Let's go on.
What's your view on the long-term effects of using a pharmaceutical, mometasone furoate, as a nasal spray, but also for itching ears?
Well, antihistamines stop all types of reactions, and I don't think they diminish in effectiveness that easily. They work, but your side effects can get worse rather than better. You'll adjust to this antihistamine after 2 weeks. 2 weeks you're unconscious and you're supposed to get better. Maybe not. Maybe you won't. Maybe you'll just stay sleepy. You might be able to tolerate, but you're not as sharp as you were. Decongestants don't really solve a problem, but they do open you up. But decongestants, I don't care what it is, I think they have a certain amount of rebound effect. So once you stop it, not like it was before you started it, and you're worse. So spray type decongestants, they're a disaster. 3 days and you better not take any more. Sometimes 3 is too much. It does open you up, maybe works for a short time. For those who don't have terrible allergies, maybe it's okay. But taking Sudafed, amazing, suddenly you're breathing, but you're going to pay the price. Yeah. Also, I noticed side effects with, I was on this cold and cough panel with one drug company, and we knew every side effect because we were working with the FDA, not the drug companies. I was a liaison. I had to report back. What did they say? And I tell them, I went and my notes. But even decongestants have a lot of problems, and most of them don't work, by the way. The one we had in my day was phenylephrine, and they still sell it. I'm not sure it works at all, and the FDA couldn't prove that it worked. In fact, the FDA couldn't prove that a lot of the 70 and 80 antihistamines actually work. Or if they worked, it actually cured the cold faster. It may dry things up, but your cold still may be 10 days, either way. So it might have given you a little relief. It was hard to do that. That's why you see a lot of new antihistamines now, because the old ones, the FDA just laughs at them. They said, you cannot mention this product. You can't advertise it. A doctor wants to write a prescription for it, or it's bought over the counter. Fine, but that's the limitation for a product that can barely prove effectiveness.
Cetirizine, Zyrtec, is that considered an old?
No, that would, I think, be considered a new line of antihistamine. Anybody else? Oh, another one? I'm going to go right back here in a minute.
Is there a test for the histogalia that's currently?
Well, there are markers on blood work that are going to tell you that, the IgE, and then the doctor's going to have to say, he's going to have to ask questions. What's been going on in your life? How do you, are you enjoying things? Are you reading? How's your acuity? And the whole thing. So he's going to figure out that you are histidilic, and the blood work's going to verify it. Yes.
So when I was a young kid, I used to get needles, shots
Yeah,
for my
shots.
allergies. And they seemed to work, but I was young enough not to really remember. But as I age, they get worse, my allergies.
Yes.
So is that shot still available that you know of? Any kind
Yes.
of shot you can get? And
You
what
can
was
get
that
the-
shot they were giving
They're
me?
Yeah, it'll be a
It's
whole,
not everything.
yeah. They test you for the allergies, they make up a serum with all the things you're allergic to. But that is almost the same idea. May not be as direct. This can't cause anaphylaxis, whereas the shot could cause anaphylaxis. They probably had you sit at the office for 10 minutes after you got the shot.
And that's
It's still a homeopathic approach to allergies.
allergy.
That one's allergy calm. Who had who had the question? of that?
Lecture,
Somebody had a hand up.
lecture.
Oh, here.
I'll ask a question.
Yes,
I had tried taking NAC
yes.
a couple different occasions, and I get stomach upset from it. Is that common? Is there something else I can take? Or?
Well, that's a problem. You don't hear it very often. In fact, I've never heard it before. But you could do, you could try a glutathione and see if that's okay on your stomach. It might just make the difference. Anyone else back there? Here, you do the mic so we don't have to repeat it.
I only have this question because you brought it up in your study, the sample where the heart rate goes up,
Yes,
which was part of the blood type diet research they did years ago
yes.
with regards to that escalation of
Yeah.
heart rates, which I see it in my own life. What's your thoughts with regards to the blood type diet?
Unfortunately, that was off. So you're talking about the blood type diet, certain foods, all foods that you might be allergic to, and they also did the testing I was talking about. They had you doing it at home. It's a very logical thing to do, but you got to remember to keep that food pure. It can't be a stew. It's got to be the individual food by itself. You could put milk in your mouth and hold it there for 2 minutes. That would do the trick, but don't do a milkshake. Too many things. It's got to be a single entity. It's histamine giving off and raising your heart rate. And I think it's pretty dramatic and pretty believable, and I think it's a good guide. I don't know if that answered your question.
No, I was
Oh, the
curious
blood-
about your opinion on it.
Yeah. Blood type
Diet.
diet in general, I personally have never noticed anything. I can't nail it down. But people come in, and if they do it dramatically and effectively, they do seem to relate some improvement. I think you got to be ready to say nothing's perfect. It helped me, I feel a lot better, but maybe I can't fix it the whole way. You can't fix, so far we don't know how to fix allergy. We can try, maybe we can reduce symptoms, but you got an allergy problem, you got an allergy problem. And climate change is just making it worse daily, yearly, monthly, whatever. So we're not getting better, we're getting worse. Anybody else?
I believe you mentioned taking D with K2.
Yes.
Is it necessary to supplement also with MK7?
So MK7 is, it's a trademark. It's done a little differently than K. It's in a, you know, I actually don't know the delivery system, how that works. But MK7 is just K, but in a special form. And it's probably desirable, but there's other desirable forms. So that's just one. And a lot of times you got to be careful. Some things are just registered trademark. They haven't proven that they're better than the original. But they may be, you know, until we know more. It's nice to have trademark products because you know they put more money into it. And I have to say, in our business, they don't pass that along to the consumer usually. They just get on the shelf next to one that doesn't have that trademark. We're a better product. We use the trademark ingredient. We paid extra for it. We may not be the company that owns it, but we're using it, and we're not charging you more for it. Sometimes they do add $1 to it. It just depends.
So it actually works the same as the things that
Any case, yeah. As a matter of fact, this particular product I like because it has K1 and 2 forms of K2. And, you know, it's a great combination of Ks. So I like that. There aren't too many like this. Most of them are MK7 or something like that.